70.
Our patients on Vancouver Island getting timely referrals to a specialist for a colonoscopy. Doctors who deal with this that are scheduling their patients for colonoscopies say that is not the case. They are now referring them off island. Joining us to talk about this from the Vancouver Island Health Authority is Executive Medical Director Dr. Tom Durran. Good morning, sir.
Good morning.
So what's the situation? Why are these doctors having to refer their patients off island?
Well, I think probably the clearest explanation, or the way that it would resonate with most of your listeners, is I think what's happened is we find ourselves in a situation where we've got an increased demand for the services, and on the other side, we're having some challenges trying to maintain our throughput and getting the cases seen through the endoscopy suite and seen by the gastroenterologist.
So why is that? Because, I mean, the doctors say they certainly can do it. I mean, they're saying that really this unit is open from 8 a.m. to 5 p.m. They say there's a shortage of nurses, a slowdown, basically, and they're not getting the patients through this. I mean, one doctor said, quoted even in the Times Colonist, that the average was 25 to 30 outpatients a week in other parts of British Columbia, where it's 16 in VIHA and now about down to 11. I mean, that's a sizable drop. I mean, that your explanation doesn't really fill, I guess, the question that I've just posed there.
So, as you alluded to, there's several challenges that we're having to maintaining our throughput, as you just said. So this is a separate discussion from the increased demand for services. And so several things have contributed to this. It's not just one issue. Now, you've already identified the nursing. Absolutely, we found that we were short of nurses earlier this year, and so we're short of nurses all throughout the health authority. And so the endoscopy unit is in similar circumstances, but. What's happened is we've been able to recruit new nurses into the position to the point where I think by next week we should be up to our full complement of nurses at both the VGH and the Jubilee sites that both do endoscopy. Now this is fantastic. We're happy to be at full service levels. However, the flip side to this is we've also got nurses that we now need to train up and get them efficient at the whole colonoscopy procedures. And so unfortunately that's just going to take some time. There's no way we can speed up that process.
So part of this also is that the government has a new kind of screening program in place for colonoscopies and colorectal cancer. Am I correct in that?
That's right.
Can you take us through that?
Absolutely. So on April 1st, I believe it was, the Minister of Health announced a program in collaboration with the BC Cancer Agency, and that was to do colorectal screening, to screen for colon cancers across the population. And this program is geared towards the population between the ages of 50 and 74. The BC Cancer Agency had done some modeling based on similar programs in other provinces, and we had pegged our growth rate at being approximately 40%. Well, what in fact has happened now that the program is rolled out and the referral process is now starting to gear up is that family physicians have truly embraced the program, and the numbers that are coming in, the numbers that are being referred in for colonoscopy has exceeded what we had anticipated.
More than 40%.
More than 40%, and so as you can
which
see,
is a good thing.
That's a very good thing. I think it's probably typical of how health conscious we are here and how we take our health seriously, and it's a good thing. But we're a victim of that success and that health-mindedness. So
what do we do about this then? I mean, if the question is that you've had this success, Dr. Durran, what do you do to keep pace with this? Or do we drop the program? Do we scale it back? Do we put new conditions in place?
Absolutely not. We're not going to drop the program. I think everyone will agree that this is a worthwhile program, and it's an important issue. Colorectal cancer is an important issue. So what we're doing is we're sharpening up our pencils, and we're looking at every, and I do mean every possible means to try and manage this demand and also increase our efficiencies. So as I said, we're now up to full nursing staff levels, and so that experience is going to be coming on board. What we're also looking at is things even as nitty-gritty as limiting the gastroenterologist, limiting one gastroenterologist to only 6 hours at a time, but perhaps scheduling two of those, one after the other, through the endoscopy suites. And the reason is we know our productivity, we know the ability of experienced endoscopists starts to drop, the longer that they're doing their shift. And so as long as we can keep fresh endoscopists on the job, we're going to keep putting them through. The other issue is we're also looking at options such as, say, endoscopy on weekends, as well as endoscopy in the evenings. Now, just as another example of how pointed we're getting about all this, I'm even looking at issues such as what are the medications we give for sedation, and what are those medications that will increase our successful colonoscopy rate, but yet also have a speedy recovery time, so we can get these people back and on their feet and out the door, and even issues such as what are the medical gases that we use during the procedure. In the past, it's always been room air, but there's been some great research and great results coming out of using things like CO2. So I'm trying to approach the efficiency at every single step. Now, in terms of managing the demand, what we've put in place actually is we have a central, what we call a nurse navigator, and these are some people. There's two nurse navigators located in Victoria, where our greatest demand is. And there's also a nurse navigator that manages the Center Island and North Island, and this is a central referral agency. And so all referrals that will come through BC Cancer and family physicians will all be funneled through this nurse navigator. And what we found actually already is that there are some people that are getting onto the colonoscopy, all endoscopy wait lists, that perhaps shouldn't actually be there. So for example, I'm talking about someone who's been referred in for a family history. Well, on further questioning, it turns out that the family member was a second wife's cousin. So there's some people, probably our numbers would say close to 20% that shouldn't be on the list. So that's part of the nurse navigator. He or she will go through those numbers and cull through the numbers, and then they will refer on to the gastroenterologist. And as well, what this nurse navigator does is not only manages the flow, but also goes through the patient education to make sure that each and every patient, the very first time has an optimum procedure.
We're talking with Dr. Tom Durran. He is the Executive Medical Director of the Vancouver Island Health Authority. Dr. Durran, let's talk a little bit about some information that patients really should be taking away from this. And first of all, I guess the screening program that you have is that you test for traces of blood in the stool, which that can be a sign of tumors, right?
That's right. So
or polyps.
What we call the FIT test, and essentially this is looking for the minute amounts of blood that can be the first sign of there being a cancer.
So if you get a positive test in a stool, what do you then do?
So positive FIT in the stool, and this is where the process still needs to be ironed out. In the past, a patient would go directly to their family physician. The family physician would refer onto a gastroenterologist, and what we're trying to do is streamline that process so that these positive FIT tests are then funneled through BC Cancer agencies. So BC Cancer has a good handle on the numbers that are happening, and then in turn we'll funnel those through to our nurse navigator, who will then meet them out to the gastroenterologist or other physicians doing scoping.
So tell me, a positive stool test, what's the recommended time to get if it goes through the process for a colonoscopy?
So according to the National Gastroenterologists Association, I think the time for a positive result to a colonoscopy is on the order of 8 weeks.
What's the wait time now in the Vancouver Island Health Authority?
I think with the new program, and given the volume that we have and the efficiency challenges that we've had, this is now stretched out to 3, 4, 5 months now.
Is that acceptable?
Well, as I said, if we did nothing and left it at 5 months, I think that's clearly acceptable. But what we're doing is as I say, trying to increase our efficiency and trying to streamline the process so that it's done in a more timely fashion. Now,
will you be able to get it? Do you think, Dr. Durran, down to the recommended 8 weeks?
I'm always confident that we can hammer away on it. We've got a fantastic group of gastroenterologists and very dedicated staffing in the endoscopy unit and the nurse navigator, and I'm confident, with our continued efforts and our constant reevaluation, that we can get the numbers down to the standard benchmark.
So, are patients being served now on Vancouver Island that have or believe they may have a risk of colon cancer?
Sorry.
Are they being served efficiently if they believe that they have colon cancer?
Yes, I think the patients are still being served because there's other options that are available. So we still have general surgeons, for example. There's 10 general surgeons in Victoria, as well as 7 in Nanaimo and scattered up and down the island that can still do endoscopy. I think first and foremost, what's important to understand is that if any patient feels that they have an urgent or emergent condition and they haven't been referred to a gastroenterologist, then they can still go to the emergency department, as has been the previous practice.
And they would receive their endoscopy there, or?
Well, what would happen is they would proceed to the emergency department, and then depending on their location, they would either be consulted on by a general surgeon doing endoscopy or by a gastroenterologist, because the gastroenterologists are still on call each day in our Victoria facilities. The
thing that kind of troubles me on this, having been through cancer treatment myself, if you said to me, okay, Stephen, we see some blood in your stool, probably a 4-month wait before we can actually get you into a colonoscopy suite, I would have to say, that just doesn't sound right to me, because I wouldn't want to walk around with that kind of fear in my mind that I wasn't being treated or that, time is of the essence.
I can understand those concerns, and certainly VIHA also understands the anxiety that a positive test like this would provoke, the wait time that would increase the anxiety, and so as I say, we're nailing down the process to look at people, someone who would sit with you and go through your risk factors and be able to give some sort of stratification as to what your actual risk was. If it, as I say, if it appears as though it's urgent or emergent, there's still the option of going to the emergency department for a more timely review by the gastroenterologist. And then certainly as a very, very last resort, we would consider referring a patient or advise to the referring physician, GP, to refer over to the island, over to Vancouver rather. But we also understand this is a huge inconvenience for patients.
Mm-hmm. I think I'd probably be trying to find some kind of private clinic myself if I was in that position.
Well, there's lots of private clinics out there, and I'm receiving faxes every day from clinics that are popping up and looking for business.
Mm. And would the health authority pay for that, or would BC Med pay for that?
Now, I'm not sure what the regulations are around MSP and what the government pays for, so I wouldn't be able to comment on that.
In previous times when there have been some backups to try to remove that backlog, the Vancouver Island Health Authority has employed some of these private clinics. Would you consider doing that to get rid of this backlog?
Well, I think, Stephen, what we need to keep in mind is at this point I'm open to all possibilities. Like I say, I'm trying to manage this in-house by looking at increasing our efficiencies, decreasing our referral base. So I think these are all options that are on the table.
But the longer it takes you to train staff to be able to get the suites up and running, the more of a backup you're going to get. So wouldn't a very short-term fix would be to engage one of these private clinics just to get rid of, even keep pace with the demand that you have today?
That's always an option. However, in terms of, you specifically mentioned training our nurses, we're anticipating within 4 weeks that these nurses will all be up to speed. And again, that's going to be a huge piece of increasing our throughput, the endoscopy suite.
Dr. Tom Durran, thank you so much for joining us this morning. Do appreciate your time.
My pleasure.
Dr. Tom Durran joining us on the program. He is Executive Medical Director at the Vancouver Island Health Authority. We'll take a break. When we come back, the other side of the story, we'll speak to a doctor that's dealing with these issues.
70.
We're trying to get answers today on what will fix this wait time on colonoscopies. Now, the Victoria Division of the Family Practice represents family physicians in Victoria. Together, those members work to improve patient access to local primary care, increase local physicians' influence on healthcare delivery, and policy and professional support for physicians. Dr. Aaron Childs is a member of Victoria Division of the Family Practice, and he joins us now on the phone. Good morning, sir.
Good morning.
We've heard what the Vancouver Island Health Authority said. They acknowledge that the wait time could be 4 to 5 months for a colonoscopy. They're putting in what they call these nurse guides that are going to be able to try to maybe slim down the amount of people that are going in for colonoscopies. What's your feeling about this? I mean, it seems the staffing levels are not there, which the Vancouver Island Health Authority just kind of acknowledged. They're working to get that up. How long can we wait? How long can we allow this to continue?
Well, I think as you've probably seen and heard from our gastroenterology colleagues, they have been dealing with this for quite a while. And as a family physician in the community, definitely sending people for these tests has been a struggle ongoing over the past, I guess year and probably longer. The difficulty is with the capacity, and I think Dr. Pearson, the head for gastroenterology, has put forward some suggestions to the health authority, and I know that they have been working at this. So.
How frustrating is it for the patients? I mean, you're dealing with this. You sign a referral today, say, hey, we've got some issues here. We need to get you in for a colonoscopy. And it comes back and says, well, we can't do it right now. It might be 4 to 5 months. What does the patient respond?
Well, it's been difficult, to say the least. Thankfully, most of the urgent things are still happening, and that, of course, is sort of the trouble when you have low capacity, is that urgent tests happen, but the semi-urgent or elective tests get shuffled further down the line, and so it is frustrating for patients. They've been told they have something that needs to get further investigated, and then they're sort of have to wait.
So how do you deal with that, Dr. Childs? Because, I mean, I'm just trying to get my head around this. I mean, I mentioned just a moment to Dr. Tom Durran that, we have a situation here. If I was a patient and blood was in my stool or there was some signs, I had an issue, I'd want this dealt with immediately because, I mean, the worry and the panic that a patient will be going through is probably difficult over a matter of days, let alone 4 to 5 months.
Well, that's correct. No one likes to be worried about something for an extended period of time, especially when it comes to any kind of bleeding that has a possibility of being something more serious. It is difficult. There's no two ways about it. And I think one of the things that the gastroenterology group and hopefully as part of this this discussion that's come up, the health authority as well are working to make this better. But it's frustrating to have to wait.
I asked VIHA why they didn't employ some maybe private clinics to get rid of the backlog, and there wasn't really a decent answer to that question. Do you think that would be a solution?
I think that one's difficult, and it's certainly not going to be a solution in the short term. I do think the gastroenterology group has put forward some suggestions as to how to improve this situation, and we've been working with them, both our division of family practice and the South Island division, at trying to push this issue forward. So,
and does it leave doctors pause? I mean, when you're seeing elements or symptoms that need to be dealt with, I mean, is it in any way kind of holding you back from referring to a colonoscopy procedure, or you just keep going forward in the hope that it's going to get dealt with quickly?
I guess locally, the issue currently has been that referring people for that locally is going to be even more difficult now. And so I think for us as family physicians, we continue to work to send patients for the appropriate tests and follow-up. And so unfortunately at the moment that's going to be further afield. Obviously, as I said, the more urgent things do tend to get done still, but the less urgent things have a longer wait to them.
And what's the impact on those patients, other than they have to wait longer? I mean, is it an issue that then could develop, that could get worse?
Of course, it depends on the situation, but typically for these types of tests, you would things could potentially get worse, of course, yeah.
Dr. Chods, thanks so much for joining us this morning. We'll follow this, and obviously with interest, and I hope that it gets resolved soon.
Yes, well, we're all hoping that.
Thank you. Dr. Aaron Chods joining us on the line. He's with the Victoria Division of Family Practice. Time for